Good morning, everyone, and good afternoon if you're in East Tennessee. We'll get started in just a moment. But while you're joining, go ahead and drop your name in the chat and the county that you're from, the name and your county. And if you'd like to share a little bit, if you'd like to share your organization, if you're representing an organization, feel free to include that. And Marsha Hawk Elliott was the first person in Williams County that responded and from Williamson County. Good to see everyone. Okay. All right, so let's go ahead and get started while folks are still dropping their names in the chat and also the county that they're representing today. Thank you for joining us. My name is Tanae Franklin, and I'm the Chief Strategy Officer at the Tennessee Justice Center. Before we get started, we just want to center on a slide. Next slide, please. Actually, the slide for the there we go. Thank you. Okay. So as you're logging on, I just wanted to read this disclaimer. The Tennessee Justice Center is a nonprofit, tax-exempt organization that is nonpartisan and non-political. The clients we serve and the partners whom we work with represent the state's diversity of political affiliation. Our political analysis relates only solely to the defense of health and nutrition programs and do not imply endorsement or disapproval of any party or person. In summary, the Tennessee Justice Center is supporting residents who live in Tennessee, regardless of political affiliation or who they are. We serve everyone, and our goal is to have the best health outcomes that we have and access to food security in the state of Tennessee. So let's go ahead and get started. We have today that's going to join us for our Q&A session, Gordon Bonneman and as well as Signe Anderson. Now, last week, some of you all may have joined us for the update on the potential cuts to Medicaid and SNAP. And we thought it would be helpful to have a more informal setting so we can answer more questions today from all of you all on the call. I'm going to ask you after the short presentations, if you have a question, to please raise your hand and I will recognize you as you all raise your hands. Please keep your phones, your computers and or your phones muted just so everyone can hear. And so with that, let's go ahead and get started. First, I am going to turn it over to Gordon Bonneman, who is our resident expert on all things Medicaid. He's been doing this work advocating for Tennesseans for access to health care for over 50 years now. Gordon, I'm going to turn it over to you. And while you're coming off mute, Gordon is going to speak for 5 minutes, and then I'm going to turn it over to Signe Anderson to speak for 5 minutes, just to level set, and then we'll jump in.
So thank you all for joining us, and I'm just going to give a brief recap for those who either weren't with us last week or were befuddled by the amount of information we threw at you. So just a quick summary. As you probably know, the president-elect Trump promised as a first order of business to pass an extension of the massive tax cuts that were adopted during his first administration. And it's expected that that will be the top priority for the incoming Congress, which is also controlled by the Republican Party. The value of those tax cuts over the 10-year period that the Congressional Budget Office uses for assessing budget impacts of 10 years is $4 trillion. The leadership of Congress and the administration have said that they intend to pay for these tax cuts, the $4 trillion worth, with cuts to Medicaid, the Affordable Care Act, and SNAP. And the reason why they are doing that is twofold. First, there is an ideological commitment to reducing social programs. They're generally unpopular with the leadership. The other reason is that the bank robber, Willie Sutton, explained that he robbed banks because that's where they keep the money. And if you're trying to come up with $4 trillion to offset the impact of the budget cuts, you've got to go where they keep the money. And that is in either Medicare or Social Security, and both of those are taken off the table, or the defense budget, that's where they keep the money, that's off the table. The large pots of money that are still available that could be cut for purposes of generating $4 trillion worth of savings are Medicaid, SNAP, and to a lesser extent, the Affordable Care Act. Of those, Medicaid is by far the largest. So it's got an enormous bullseye on its back. And even though you probably have not read about this in the media yet, you can be sure that this is going to be coming at us fast and furious in the Congress that starts January the 3rd. And when I say fast, I want to explain briefly that we're talking about the Congress using what's known as the budget reconciliation process. And without burdening you with too much of the technicalities, some of you will recall that the usual path through Congress through the Senate requires a 60-vote supermajority to overcome filibuster, which can just block passage of legislation. If they use the budget reconciliation process, it cannot be filibustered, and there are only very limited amendments that can be put on the bill. So it's basically put on a fast track to ultimate passage. What will happen probably in January, certainly no later than April, is that Congress will first adopt what's known as a budget resolution, which says we intend to take this much money out of these programs to pay for tax cuts worth $4 trillion. And they will say, we're targeting Medicaid, we're targeting SNAP, we're targeting the Affordable Care Act, whatever the places are that they intend to go for the savings, but those are the programs that they've identified, and just given the money that's involved, that's where they keep, those are the bank vaults to raid. They will give instructions to the various committees. In the case of SNAP or food stamps, it's the agricultural committees in both houses. There are other committees, Ways and Means in the House, as I recall, and it's Commerce subcommittee, and a different committee in the Senate. But in any event, those are the committees that authorize amendments to the legislation and draft the amendments. So they're given a task: come up with amendments, cuts to the design of those programs that will generate this amount of savings. And we won't know what those specific cuts are until months from now. And that makes it difficult to oppose them being targeted, because we got a lot of questions, and I'm sure there'll be questions today. Well, what specifically is going to be cut? And what will happen first is, well, we just know they're going to get this amount of money out of Medicaid, or this amount of money out of SNAP, or this amount of money by cutting the Affordable Care Act. We can't give you the specifics because they aren't known. They won't be known until the amendments are put before Congress later in the year. The problem is, once the budget resolution has been adopted, targeting those programs, it's very difficult to stop the cuts from happening. So that's why we are, those of us who have hair are setting our hair on fire, and the rest of us are shrieking loudly to say, this is coming at us right now. There's not a moment to waste. We need to let Congress know, hands off these programs. Whatever you want to do about tax cuts, do it if you must, but don't cut these programs. Don't shred the safety net, which is what the programs are that we're talking about. So that's a summary of sort of where we are right now, the dilemma that's facing us. I asked a colleague in Washington last night for an update on the timing? Was there any more intel about when exactly the congressional leadership would push a budget resolution? And his answer was, we expect a shock and awe campaign in January. So that's all that we know right now.
Thank you, Gordon. Signe, can you give us an update regarding SNAP? And the reason, before you do that, let me let the audience know, the reason that we are tying Medicaid and SNAP together is because it affects all Tennesseans. We know that Medicaid is really significant, but so is SNAP. And so we can't choose one without the other. So that being said, Signe, I was wondering if you can give us the impact of SNAP. Who does it impact? And the proposed cuts, what would Tennesseans expect?
Yeah, thank you, Tanae. And thanks, Gordon, for kicking us off. So for the folks who joined us last time, we mentioned how SNAP, which many of us know as food stamps, is the nation's most important and effective anti-hunger program for Tennesseans. On an average month this year, over 750,000 individuals participated in the SNAP program. So that's every county is impacted by hunger and has the benefit of the SNAP program to help people who are struggling with food insecurity. In 2022, there's data that shows that 140,000 individuals were lifted out of poverty because of the SNAP program. So that just gives you a little snapshot of who participates. Seniors participate, children participate in the SNAP program. Working families with low incomes participate in the SNAP program. And then as far as the cuts, we mentioned one of the immediate things that we were looking at, and Gordon lifted up, was the continuing resolution and the budget reconciliation. One of the things that we are concerned about is additional funding for families who have experienced skimming, have had their benefits stolen from them. We are all familiar with using our credit cards. If we have credit cards that have been implicated, we can get our money back. Has not always been the case for SNAP families. When they have their SNAP benefits stolen off of their cards, they did not get reimbursements up until 2023. And so that's been funding that has just been made available for families who participate in SNAP, who experience skimming. So that's something that was being decided, and we have until December 20th to have funding continued for those families. It looks like for the short term, that's going to go through, but as Gordon mentioned, starting next year, that could look very differently. So that's one area. Another area that we're concerned about for SNAP families are families being cut from the program, families getting much fewer benefits. One of the big targets under the previous Trump administration was working individuals and cutting folks who are struggling to find work from the program. We want to make sure that families who are struggling to find work are not prevented from having food. And so that's another area where we foresee cuts and threats to the SNAP program. And then also fewer benefits. Under the previous Trump administration, they asked Congress to do a study of whether or not there was adequate benefits amounts for families. And so that study was petitioned by the Trump administration. The results came out under the Biden administration, and as a result, it was determined that families after 40 years should be getting a higher benefit amount. And the Trump administration has indicated that they intend to overlook those findings and roll back benefits, and so making the benefits much less for families at a time when families have been struggling with increases in costs. Food is much more expensive now than it was because of inflation, and so all of those things are examples of what we foresee as threats to the SNAP program.
Thank you. Thank you for just level setting, Signe and Gordon. So we're going to spend the bulk of our time answering questions. We already have some that have dropped in the chat. Remember, if you would like to actually just drop your questions in the chat. I think that would be helpful for us to make sure that we get to all of them. So the first question that we have, practically speaking, hold on. Practically speaking, what will the Medicaid cuts for Tennesseans who get Medicaid? What does that mean with regards to reductions in services or lower spending caps? Gordon.
Great. Great question. And let me digress just a moment to talk about what is likely to be the principal vehicle for achieving these huge savings that are planned by cutting Medicaid, and that is to convert it into a block grant. And a block grant would cap the amount of money that the federal government would pay into the cost of the program. Right now, 2/3 of the cost of Medicaid is paid for by the federal government. The state pays about 1/3, a little bit less. And that's open-ended. That means that if more people come onto the program in a recession, or we have a pandemic and more people get sick, then Congress appropriates more money to take care of whoever qualifies and provide whatever services those folks need. If it's converted to a block grant, it turns into the kind of appropriation that we have for things like the WIC, Women and Infants and Children program, which provides nutrition assistance for nursing mothers, pregnant mothers, and infants. That is a block grant. Congress appropriates X amount of money each year. And if we run out of that money, then people don't continue to receive those benefits until the start of another year and a new appropriation. Medicaid, SNAP, and the Affordable Care Act are all different. Those are entitlements, which again means that whatever amount of additional cost is incurred, the feds will match. In the case of TennCare, it's two for one basis. So it gets converted to a block grant, that gets capped. And as costs go up, and we know that they will go up because medical inflation has exceeded the rate of growth of the economy, not only in this country, but significantly across the industrialized world for half a century. So we know that it will get cold in the winter. We know that it'll get hot in the summer. We know that there will be healthcare inflation. There's no question about that. And that it will exceed the rate of state revenues. And that means that if you impose a block grant, each year the state has to cannibalize part of the program to stay within budget. That's the goal, is to create a block grant. What that does from a federal perspective is it just locks in what the federal government will spend. That won't go up any more than what is allowed. And it shifts to the state the hard choices for cutting the program. That's its great appeal to Congress, is that we save the money and the state is left holding the bag, having to make the cuts. It also means that we won't know what those cuts will be. So back to the question, which is an excellent question about what is the implication for Medicaid beneficiaries, and specifically those receiving long-term services and supports, either in the home with home and community-based services or in nursing facilities. The answer is we can say with certainty that they will be adversely affected. We can say with certainty that everyone receiving TennCare will be adversely affected, likely very seriously. And the reason why I say that is that the scale of the cuts that are being proposed are so large that nothing will be spared. And in fact, we can talk about this later after addressing everybody's questions. The truth of the matter is that if they impose the size of the cuts necessary to pay for the tax cuts, if they impose those on Medicaid, then it will lap over into, it will mean billions of lost revenues to the state budget, and it will then wash beyond TennCare to affect things like education, K-12 and post-secondary. So
thank you. Yeah.
That's
thank you. Yeah, thank you, Gordon. I think we're gonna reinforce the same message over and over again throughout the call. I want to make sure that Amelia had her hand up, and if Amelia, if you still want to ask a question, go ahead and raise your hand again. But until then, I'd like to lift up Danielle's question in the chat. How does SNAP currently help children in Tennessee? And how could these potential cuts impact Tennessee children?
Thank you. That's an excellent question. Just to paint a picture for folks, I think sometimes there's a misconception about children participating in SNAP when in actuality, 71% of SNAP households that are participating in SNAP are households with children. So a large portion of participants are children. So if parents aren't able to tap into the SNAP program, that means less food in the refrigerator. It also has larger impacts on our schools. For folks who are connected to schools, children who are enrolled in SNAP are directly certified for free school meals. And it streamlines systems so that schools and kids have access to free school meals. It also helps school funding as well. So when children are cut off the SNAP program, there are lots of implications for children and their families. Children who don't have enough to eat, aren't prepared and ready to learn at school. There's a lot of social and emotional trauma that goes into being food insecure. And so children, we want to make sure that children have access to this program, and therefore families who have children are connected to SNAP.
Follow up, just really quickly before we get back to Medicaid. Does SNAP funding impact free and reduced lunches at schools and across the state?
Yes, it does. So if children are not having access, if families with children are not having access to the SNAP program, that lowers the number of participants in the SNAP program, and therefore would impact school funding. The more children that we identify as being eligible for SNAP, they get directly enrolled in free school meals, and that ultimately helps schools not only to better serve kids, but fund larger programs within the school. So yes, and then the other thing too, I had mentioned up at the when we started talking about today's topic, that SNAP had pulled 140,000 individuals out of poverty in 2022. Of that 140 number, 53,000 of those individuals were children. So it has major positive impacts when children are connected to the SNAP program.
Thank you. Now, Gordon, going back to the block grant, we have a couple of questions that are asking about the structure of the block grant. Do we have details or a better understanding, potentially, if they do try to block grant Medicaid, what that structure would look like?
Okay. Thanks, Tanae. Yeah, and I saw a question in the chat about doesn't Tennessee already have a block grant? The answer to that question is we have what has been called a block grant. It was modified after it was originally granted, and you may have read about it generating, quote, shared savings to pay for adult diapers and to pay for hurricane reconstruction in East Tennessee. That is not what we're talking about. In fact, there's a technical exchange in which the state acknowledges that's not a block grant. Even though it refers to that. What we're talking about at the federal level would be mandatory. What we have in TennCare was a special negotiated waiver agreement, and it has been a good deal for the state. That's not what we're talking about. It would be at the federal level, a block grant would just cap the amount of money that would be afforded to the states. It would probably be coupled with deregulation. So it would say the states are free to run the programs any way they want. What that will really mean is that with less money, they will be free to take the hard decisions about who gets cut. No politician wants to be in that position, so that would be Congress shedding that burden and shifting it over to state officials. And there are three ways to control the budget in TennCare or Medicaid. One is to limit the number of benefits that you provide. We just won't pay for drugs, or we won't pay for nursing home care, or we won't pay for as much of it. Another is to say, we're going to cut this group of people off the program. And the third way is to say, we're going to keep the same people and the same benefits, but we're going to pay providers less. At the level we're talking about, these block grants, all of those things would happen. And that's why I say I don't think anybody can assume they will be spared. People receiving long-term services and people providing long-term services and supports will be adversely affected. Hospitals will be affected. TennCare is the largest source of coverage for rural Tennesseans. And as you may know, we're already #2 in the country in terms of rate of hospital closings in rural communities. This would absolutely hammer rural health. So you're going to hear this repeated. It's really big, but everybody's going to be provided. We can't give you the specifics yet because we won't know until later in 2025, but take our word for it. It's huge. The scale they're talking about, you can't take $4 trillion out of these programs without utterly shredding the safety net in ways that are literally unprecedented in this country.
So Gordon, there's another question that came through. Will the proposed Medicaid cuts, with the proposed Medicaid cuts, are there programs such as ECF choices, and ECF stands for Employment and Community First Choices? Will those programs be at risk of discontinuing?
I don't know whether they would be at risk. I mean, conceivably they could be discontinued. It's more likely that they will just cap them and say we're not going to have a wait list, or we're going to increase the eligibility requirements so that people who are getting those benefits now won't qualify. There are any number of ways to mix and match. Again, they can cut the number of people, they can thin the amount of benefits that you can get, or they can reduce the payments to providers. All of those affect the beneficiaries, including payment to providers. If you cut the rates to providers, they won't want to treat Medicaid patients or TennCare patients. So it's not like there's a shortcut somewhere. And if you say, well, if you're a provider and you say, well, cut the benefits. Well, if you're a provider of those benefits, that's coming out of your pocket as well. So all of this is an urgent call to say everybody is at risk. And if we have time, we can talk about why at this scale, schools and K through 12 are all impacted as well.
So thank you. And so for just to reiterate some of what's going on in the chat, and thank you to the TJC team, Reed and Josiah, for dropping information in. We do have a link, also a detailed link to that details the cuts for SNAP and Medicaid for the webinar that was posted last week. We have the infographic fact sheet that we shared in the chat. And also we created just this morning a detailed projected financial impact for the state of Tennessee. Gordon had lifted up before Medicaid cuts to the state budget would impact at the upwards of $3.8 billion. But Gordon, I'm wondering if you can we know what's happening for individuals on Medicaid, but how does this impact other individuals that are not on Medicaid? So for instance, how will these cuts impact other state agencies? And then after you speak, I'm going to come to Danielle for another question.
Sure. I'm muted. No, I'm sorry. People are generally not aware of this, including our state legislators, but Medicaid funding, federal Medicaid match, helps defray the cost of administration, not only of TennCare division, but the Department of Children's Services, the people who respond to crisis calls about neglect or abuse of children, the Child Protective Services, those are technically classified as case managers for TennCare, and their salaries are paid by Medicaid. Department of Disability and Aging, the Department of Health, the Department of Human Services, the Department of Mental Health and Substance Abuse Services. Medicaid funding, federal funds flow through all those departments. And so the scope is very broad. The reason why we say this will affect people not receiving TennCare is that if you look at the role of federal funding, almost $1 in $5 coming into the state treasury is federal Medicaid match. If that gets cut, it is a cut that is so large that it can't all be absorbed by cutting the TennCare program. And it would inevitably wash over into other state-funded programs. Number one is K through 12 and post-secondary. So education will definitely be impacted. It can't be spared. It's like, you know, if you anticipate a tidal wave or a storm surge that exceeds a certain number of feet, you can just know that it's going to wipe out an entire community. And that's what we're talking about here.
Could you, okay, so thank you. We're going to come to Danielle and then we're going to continue on, Gordon, for your question. But Danielle, go ahead and answer. Well, actually, Danielle, hold on. Amelia is back. And so I'd like to make space for Amelia Rome, I believe, and then we'll come to Danielle.
Hello, this is Amelia Rome. I'm blind, so I'm having some difficulty entering my question in the chat with my screen. So part of my question is I know that a huge portion of Tennessee is quite rural. And with these cuts, among the questions I have is I have read among the
Amelia, you're breaking up. Could you just maybe elevate your voice a little bit?
Yes, I do apologize.
Amelia, can you hear me?
I hear you.
No,
Can
you're
you hear
breaking
me?
up. Yes, if you project your voice, we
Oh,
might be able to hear you better.
I've heard that they are considering adding work requirements to Medicaid recipients as well as people receiving disability benefits. And it seems to greatly impact people living in rural areas of the city. We're finding work that would provide a living wage could be very difficult.
Thank
So
you
my
for
question is,
that.
do you see as
So I think Gordon, the question is around work requirements, and we've heard this a lot, particularly in rural communities where there may not be an opportunity for jobs, much less competitive jobs. So can you speak to work requirements and with regards to how it's going to impact individuals on Medicare, and also particularly in rural communities where there aren't opportunities for jobs?
Sure. Thank you so much, Amelia, for an excellent question. That we know for certain, when I've said we don't know exactly what would happen, I think we can say with certainty that the Congress will come with proposals to make work requirements a mandatory part of Medicaid. We know from limited experience, a number of states tried it before they were shut down by the courts, that well, for one thing, just a statistic about people who are on TennCare, half of them are children. A substantial number are people with disabilities or seniors. Among the non-disabled adult population, we know that the majority of them are already working. So, and we know a couple of things about work requirements as they've appeared in other states, that the question of a living wage doesn't factor in the question of whether you're making enough to offset the costs of childcare. If you're a single mother with 2 or 3 kids and it doesn't make any sense for you to go to work at minimum wage because you're going to pay more for childcare, at least if it's safe and decent childcare, you will. Those kind of considerations don't figure in. We're dealing with an ideological perspective that says people that are on these programs just need to get out and work. There's ignoring the fact that to the extent that they can, they already do, they want to work. The big problem is, we know from experience, is that reporting the work, the paperwork requirements of documenting that you work, getting employers to collaborate in confirming that you meet the work requirements, all of that creates red tape hurdles that can cost many, many people their eligibility, even though they're working. So it's a very serious threat. We know that that's coming for certainty. And in fact, Tennessee already has in effect a trigger law. We passed a law 5 years ago to require the state to seek a waiver from the federal government to adopt work requirements. That was never approved. If Congress approves a change to the law, then that would immediately take effect. And it would disastrously impact a lot of single parents with small children in particular. And as you point out, particularly those in rural counties where the job market is not good.
Thank you. All right, Danielle, you are up.
Thank you. This is a question for both of you, and I think it actually might go along with another question that was in the chat. But Gordon, I believe you mentioned that we're just not hearing about this in the media. So I'm wondering what exactly we can do to help this gain traction in the media, since we're just not hearing about it.
By the Disability Coalition and I'm sorry. Thank you. We are having a press conference tomorrow to try to get the word out that's being co-sponsored by our friends at the Tennessee Disability Coalition and Age Well Middle Tennessee, to try to acquaint the press with this, what will be a huge story. I think the reason why we're holding these sessions and are so grateful to you, that to those of you who are joined, is that we really need all of us to get the word out. Talk to your churches, your Sunday school groups, your neighbors, you know, whoever you have social relationships with, your social media networks. Please let them know to pay attention that this is coming. So I think the reason why it's not on the radar is that there's been, you know, all sorts of international developments. The incoming congressional leadership has kept this close to its vest, has not talked about it yet very much. There have been a couple of stories in the New York Times and Washington Post, but in terms of general awareness, it just hasn't gotten out there, and we have to change that.
Tanae, I had a few other things just to lift up too on that point. You know, we serve clients from across the state who are often not heard, right? Their stories are not heard. And I think that's another really important thing to lift up. If you have a personal story, trying to connect to benefits, whether it's healthcare or food assistance, telling your story is a really powerful way to show the practical and important functioning of these programs. So that's one thing I'd lift up. If you work in schools or work with children who you know are connected to the SNAP program, I think telling that story makes a huge difference in helping lawmakers and decision makers to understand how the programs actually work and why they're so important. So that's one other thing that I wanted to lift up.
That's helpful. So Signe, so I do, my career has sort of been in this space of health equity and addressing health disparities. And when it comes to health inequities, we know that there are social drivers, and so food security is one of those social drivers. So if we have access to food resources, we're less likely to be ill. And if we're less likely to be ill, that for some of us at least, we may not rely so heavily on Medicaid. So can you talk to how SNAP actually lifts folks up out of poverty?
Yeah, I'd be happy to. So families who have who are connected to SNAP, they've now have money to buy food, and if you don't have those funds, there are other areas, other basic needs that aren't being met. I often hear the quote that the rent eats first. So if you have money to pay for food through the SNAP program, now your family might be able to afford rent and be able to stay in your home. Another thing that we hear so often are seniors who need to eat in order to take certain medications. They're not eating because they don't have that connection to the SNAP program. When our seniors have food through the SNAP program, they're able to take their medicine, and they're able to remain healthy and not have to go to the hospital because of an emergency. So I think having those fundamental basic needs met through the SNAP program, through healthcare, really help to create a foundation for our families, and ultimately helps to lift them out of poverty.
Thank you. Now, Signy, I'm coming to you one more time, and then I'm going to ask some more questions. I'd like for Goran to chime in. So for my friends, my political friends in this space, when I talk to them about the impact of Medicaid and SNAP, oftentimes they're like, oh, that's just politics. It's not really going to happen. They know our legislators, our senators, our congressmen know the impact. And so it's just sort of a lot of pomp and circumstance. What do you say to individuals who think that it's not a big deal?
I think that people who are saying that have never participated in the SNAP program, have never relied on SNAP benefits, because anything that the country does to cut SNAP benefits or cut healthcare, folks with the lowest income feel it the hardest. So, even if you don't lose your benefits completely, if the minimum benefit that a family can receive is just $35, $35 a month is not enough to survive on. If that's cut even more, a family who is low income will feel that they won't be able to buy a vegetable, or they won't be able to afford milk. There are things that we don't see as folks, for those who do not participate in SNAP, don't feel the impact of. And so I would say that's absolutely not true. The things that happen will impact our families across the country. And also, I think many of the folks who might be considered middle income will start to feel the impact and as well. So everyone's impacted.
Thank you. And Gordon, what would you say to those same politicos, if you would, that said, oh, the cuts aren't happening, the cuts to SNAP, the cuts to Medicaid, it's not going to happen. It's just sort of the media sort of hyping things up. What would you say to them?
I would say that they need to go look at what the leadership has said they intend to do. The incoming Congress, the congressional leaders, the think tanks that they take their direction from, and the Trump administration officials have all said that they are going to push the tax cuts. We know what the value of the tax cuts amounts to over 10 years, which is $4 trillion. And they've said that they're going to get the money from these programs. So it's a matter of taking what they say, looking at the math, looking at what the math means in Tennessee, and then figuring out how that extends over the millions of people that will be affected.
Thank you. Now we're going to pause for a brief moment. So Cameron and I believe it's Jessica have already used the QR code and sent a letter to their our elected officials. So I'm going to ask, first, Reed, can you put up the slide for the QR code? And then also, if you can drop the link in the chat. If you all can take a moment, it will be really, really brief, but we need our elected officials to hear our voice. Hope is possible. And I know we sometimes get overwhelmed in this political discourse. But this is the time for our elected officials to hear what our intentions are with regards to the ask to not cut, to actually leave Medicaid where it is, leave SNAP where it is. If you're going to do anything, we need to expand Medicaid, but we're going to just leave it where it is right now. So please go ahead and scan the QR code or either click the link if you're not as tech savvy like I am. My daughters are definitely more tech savvy than I am. Okay, so there is another question that I saw. Gordon, can you speak to the size of the cut to the safety net? At what percentage do you think that the safety net will be cut? Just so we could have a better understanding of the impact.
Well, so the world in which we're operating is one in which there's going to be a $4 trillion tax cut. That's the expectation. That's the goal. And I think that we can reasonably expect that to happen. People are generally welcoming of tax cuts. So the question is, will those be done on the backs of these programs? That's the big question. If Congress takes 1 trillion of that 4 trillion out of Medicaid, that would translate into a $1.2 billion cut to the TennCare program. If they take 2 trillion of the 4 trillion, that would translate to $2.5 billion out of the state budget. If they take 3 trillion out of Medicaid to pay for the tax cuts, that would translate into $3.8 billion cut. To put this into perspective, the state budget this year is $52 billion. So we're talking about several percentage points off the state budget. And the budget, we know from experience in recessions where there's a loss of revenues, when you see even 1% or 2%, and here we're talking about larger cuts than that to the state budget, that washes over all of the areas of state activity. So we're talking about some really, really large numbers.
Thank you, Gordon. Cindy, we have another question. Could you talk to us about how SNAP funding impacts farmers, particularly if there's a reduction?
Can you hear me okay?
Yes.
Good. Yeah, so farmers they're the ones who make the food. They're the ones that are part of the local economy, and what what SNAP families spend their benefits on directly impact not only farmers but grocers. Right, the money that comes on to SNAP EBT cards is spent directly in local grocery stores, and so farmers and grocers are all connected to that. And so if SNAP benefits are cut, that means billions are not coming into the state economy. So yeah, it's a pretty direct impact.
Thank you. So Gordon, we haven't talked about the Affordable Care Act, and I have not heard it in the media. Can you tell us, one, what we should know about how the Affordable Care Act will be impacted with proposed legislation, anticipated legislation, and then how that ties to Medicaid?
Thanks, Tanae. It's likely that the Congress, among the things they're talking about, is to remove the special funding for Medicaid expansion. Probably most people on this call know that Tennessee is one of only 10 states that has not expanded Medicaid. That's been a very important goal for us to achieve that. That the funding for that would probably be taken away. Certainly that's being talked about. And it would have a serious impact on the 40 states that have already done it, a number of which have trigger laws that say that if the rate of funding at the federal level goes down, those folks will immediately lose their coverage. We've been talking less about the Affordable Care Act for two reasons. One, the Republicans made a very concerted effort to repeal it during the first Trump administration, and that proved they failed. And now the program is much more popular, including a lot of middle-aged people with pre-existing conditions who are able to get coverage through that. So they may be a little bit more wary of going after that program directly. The other thing is that it's just not as much money. And again, operating under the premise that you rob banks because that's where they keep the money, there's not that much money in the ACA compared to Medicaid. So we need to speak up about the Affordable Care Act, and I appreciate that question. We're just talking more about Medicaid and SNAP here because those are perhaps more vulnerable, and we know that there's a goal of going after those programs.
Thank you. And if everyone, sometimes we come off mute, I've done that, just if you can stay on mute, then we can cut down on the background noise. If you do have a question that you would like to lift up and give voice to, feel free to raise your hand. So we hear about contacting our congressman, but how should we target it? Sort of, what is the thoughts with contacting our Tennessee delegation versus other congressmen or other members of Congress, excuse me, or senators, in terms of asking them to please leave Medicaid and SNAP the way it is? Gordon.
Great question. I mean, that's the elephant in the room. I mean, literally the elephant. We're talking about the Republican Party here. And we're talking about a delegation that is overwhelmingly Republican. Only Representative Cohen in Congress is in the Democratic Party. The rest are not only Republican, but very closely tied to President-elect Trump. What are the chances that they would split off from the leadership on these issues? And I just want to, so I'm grateful for that question being asked. And the answer is, we don't expect them to part company with the leadership or with President Trump. But we have a very important role in this state, which is to let them know how popular these programs are, to not damage the safety net. And the reason why that makes a difference is that, particularly in the House, where there's a very narrow Republican majority of only a handful of votes, and a number of the Republican members are ones from Democratic districts that flip seats but are vulnerable in the upcoming midterm elections 2 years from now. They're very sensitive about losing their majority in the House. And if the leadership, which is calculating the plans for the budget resolution, what to include in it, what's the timetable for moving it, they need to hear from their members, including the members in Tennessee, saying, you know, we're getting a lot of pushback on this. Now, the leadership will know that the Tennessee delegation, whether the Senate or the House, will vote for the cuts regardless. But it's very important for them to hear, even in the red states like Tennessee, these programs are popular and there is resistance to them being cut. That factors into the leadership's plans. So we have a responsibility and an opportunity in Tennessee to make our voices heard at a level that reaches through the delegation up into the leadership that is making these decisions. So the fact that Senator Blackburn or Senator Haggerty or Congressman Green or Desjardins may ultimately vote to cut these programs, maybe hostile these programs, we're not operating under any illusions about that. But there is a game plan here, which is we are working with colleagues in all 50 states that are all doing the same thing to say with one voice, don't cut these programs. That echo chamber reaches the leadership. That's how we have an impact.
Sydney, what organizations are advocating for defunding SNAP? Do you have an idea of that? Sort of where the opposition is coming from? Sort of how do we think about that?
Yeah, so I mean, there is an organization known as FGA. They will often come into states, they're not even from Tennessee, but they'll come into our state and will suggest all these very severe and limiting pieces of legislation. And there are a couple other groups like that, advocacy groups that work contrary to what we're trying to achieve and don't understand how the SNAP program works for Tennessean families and individuals. Those are a couple examples.
So FGA stands for Foundation for Government Accountability. Okay, I just Googled it. I learned something new today. So thank you. All these acronyms. So thank you. That's helpful. And so I know that your team does a good job of trying to understand the pulse of stakeholders in terms of what their concerns are. But I would say, let me say this to participants on the call right now. We cannot sit back and just think that everything's going to be okay. From what I'm able to ascertain from the conversations that I've had, this is it. This is probably, and Gordon, correct me if I'm wrong, have you ever seen anything like this before in your career?
No, this is completely without precedent. I've lived through 10 care cuts before. I've lived through cuts in other social programs. This is on a scale that just, again, there's no comparison. And I think that's part of our difficulty, is that we're trying to let people know that something is about to happen that they've never experienced before, and it's difficult to imagine, but it really is potentially tremendously destructive.
Thank you. Okay, we have 2 minutes left. I want to be respectful of everyone's time. Signe, what's your doorknob comment? What's the message that you want everyone to leave here with today?
Ultimately, no cuts to SNAP. We want SNAP to be protected for families across the state.
Thank you. And Gordon, what's your take-home message?
We hope we're going to generate some news coverage of this. We're going to be doing our best with the news conference tomorrow. If you can write a letter to the editor about this, that really makes a difference. Congressional staff follow the comments in the newspapers or on social media. So again, we're trying to send a message to our delegation. These are popular programs, don't cut them. And those are additional opportunities to be heard on that. Thank you so much.
Thank you. Reed, can you put up the next slide? Okay, so this is the fact sheet. Feel free to click on here. And also upcoming events in the new year. So we are not sitting back. I know it's the holiday season and we're trying to balance sort of being with our loved ones, but also keeping our eye on the ball. And so we respectfully ask that you do the same as well. If you can bookmark and just register for our upcoming events, visit our website. We have loads of information on our website. If you see any type of social media, well, first follow us on social media, on LinkedIn, on Instagram, on Facebook, and I think TikTok. That's not my generation, but I respect social media. But if you do, as you're retweeting, go ahead and retweet some of our posts to your friends and family. And lastly, don't give up hope. We know that we can make a difference. It's all about messaging and making sure that we let our elected officials know that we do not want anything to happen to Medicaid or SNAP, because we need that for our families, our friends, our communities, and for those that rely on the programs. Thank you. We look forward to seeing you in the new year. Have a good day.